Hello, good morning.
Good morning po. Kamusta ang audio?
Karga lagi yung mga printer. Kasi na, okay na ito mga ano.
Kita maka-unmute.
Dili, giayo yan, giayo. Oh, giayo niya.
Wala, no connection ta. Ano, it's not a good sign.
Yan na lang yun. Yan naman ang pwede kayo kung pwede. Kaya lang ko follow up po diya. Ay, text ko, salamat. Sara, sa laboratory. Salamat ya. Ano mo eh? Wala daw. So po ni si pay-per-view eh. Labi na ko ka.
Hi, good morning everyone. So, napatay mga 18 minutes before we start. So, sit back and relax lang po. Thank you.
Hello, good morning, participants. Just a few reminders for our webinar. Use earphones or headphones to minimize background noises. Post your questions using the Q&A box at any time during the meeting. If you encounter any technical difficulties, example the no audio or video or any comments, you may post your queries on the chat box. And everyone is encouraged to participate, stay seated, and present at the moment. Avoid multitasking and please turn off your mic. So please stand by as we will begin our meeting in a few minutes. Thank you.
good morning. Okay, it's already 10:15 na, no? So we have 64 participants who are able to join us today. So in behalf of our regional coordinators, we would like to welcome you all for joining us and for giving at least at least an hour or 2 hours of your time for us to discuss yung exercise 11, yung about treatment of TB in special situations. So, short lang atong session karon kay ang atong DRTB is na-move nato no kay we had a delay in uploading the video of the lecture. Okay. So, start na ta. So, first question is, Mrs. Cruz, 25 years old woman, sought consultation in your clinic with chief complaints of hemoptysis, 2 weeks cough, and an afternoon fever. As a competent health worker, you will most likely do the following initial evaluation for all cases of TB among childbearing age in assessing for pregnancy. Select all that applies. So this question has multiple answers, but because si Google murag di siya makaklik daghan, no, we don't know what happens. Kung makakorek mo sa isa, credited na po yung points nyo. So, can we ask for your answers po? Kindly key in your answers po sa chat box. Okay? So, Ma'am Catherine answered letter C. And what else pa, ma'am? Ano pa po? Select all that applies. So, may nag-answer C, may nag-answer A. Okay. So, so the correct answer is letter A and letter C. So we have to do a pregnancy test and to get information of first day of LNP because we want to make sure na before we start treatment, before we start treating the patient, we would like to roll out kung buntis po ba ang patient or not. Although generally speaking, our first line anti-TB drugs, yung oral TB meds, no, are safe for pregnant women. But there are some doctors who prefer, for their best clinical judgment, to delay the treatment until after the first trimester. So yun ang reason. We need to know kung buntis po ba ang patient or hindi. And also, just to make sure if ever drug-resistant ang TB, we all know that most of our drug-resistant TB are teratogenic to may bad effect siya sa children. So, kailangan pong ma-rule out muna kung pregnant or not para wala pong mangyaring complications during the treatment. Okay. Number 2, the regimen for Mrs. Cruz once she is confirmed pregnant should include 3 to 4 oral drugs deemed to be effective but should not include the following. So, among these choices, isoniazid, prothionamide, streptomycin, ethambutol, alin po dito yung hindi pwedeng ibigay sa buntis? Okay, ano po yung answers nila? Okay, can we see answers sa group chat po? Okay, may nag-answer ng B. Okay, what else pa po? Meron po ba? Okay, the correct answer is prothionamide and streptomycin. Ay, may nag-chat. Walay video. We are, mayroon pong screen share. Klaro po ba yung screen share sa lahat? Sige, i-check na mo ulit ang screen sharing for a while po. Okay. Sorry, parang wala di ay screen. Wala mi nakabalo. Sorry. Do we go back to question number 1 or padayon na ta? may padayon na lang. So, ang answer po sa number 2, yung gamot na bawal for pregnant women is protein and streptomycin. As we all know, ang effect ng streptomycin sa baby, pag-detect sa pregnant mother is death ang bata paglabas, no? And for proteonamide naman po, study shows na meron siyang teratogenic effect sa baby. So, two of the recorded reasons kay ang bata will be low for gestational age and small for gestational age and low birth weight. So, to avoid na magkaroon ng complication or negative effects sa bata, yung we avoid proteonamide streptomycin po. Oh. Maingay daw po. Okay. No audio. Wait, we will check our audio. Okay. Naka-mute to. Mute to. Okay, wait lang. Wait po, we will check our audio. Ang iba po, how's our audio po? Is it clear? Or may maingay? Okay lang po. Sige. Let's continue. Okay. Patient Conching was diagnosed with tuberculosis. However, she is nursing her 3-month-old baby. As a health worker, you suggest to feed her baby with ano po yung time? Okay. Mostly answered letter B. Yes, okay. Correct answer is feed the baby before taking her anti-TB meds. Okay, number 4. Patient Corazon is under your care and she is receiving anti-TB medication, which includes bedaquiline and delamanid in her regimen. She is breastfeeding her 5-month-old baby. Based on her sputum microscopy, she remained positive for tubercle bacilli. As health worker, what is the best action to suggest to patient Corazon? Will she continue breastfeeding her baby? Discontinue breastfeeding her baby? Defer breastfeeding until 2 years old? Or give cup feeding instead of breastfeeding? What is the best suggestion we can give to the patient? Okay. The correct answer is letter B. The mother should discontinue breastfeeding her baby because if the regimen contains bedaquiline and delamanid, usually po, these two medicines are excreted in breast milk in animal studies. So, it's safe to assume na lang din na to be safe, i-apply din natin yung concept na to sa human being. So, and then decide whether to discontinue the drug or breastfeeding as an alternative weighing benefits and risks with clinical considerations. So, studies on animals show na na-excrete sa breast milk ang two medicines na ito. Okay, we have i-mute po muna namin yung mayroong naka-on na mic. Okay, thank you. Okay, number 5. A breastfeeding mother who is not undergoing appropriate treatment or still has positive culture, it is important to emphasize that during breastfeeding, she should breastfeed inside the room. B, use a surgical mask or respirator. C, there is no special preparation needed. Or D, none of the above. Okay, ano po yung answer natin? Okay, B, 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 halos lahat B. Okay, the answer is letter B. So, the mother should avoid exposing the child with the bacilli, no, since positive pa rin po, no, we would like to prevent transmission. So, she should wear Contact should occur in an open air space, if possible, with the mother wearing a surgical mask or N95 respirator. Number 6, female patients who vomit at any time after or within the first 2 hours after taking contraceptive tablet should use what? Um, Vasectomy, lactation or menorrhea method, barrier method, or symptom terminal method. Okay, ano po yung answer nila? Barrier, C, okay. C, most lang answer is letter C. So let's check. Okay, the correct answer is letter C. Patients who vomit directly after taking oral contraceptives can be at risk of decreased absorption and therefore of decreased efficacy and should be advised to use a barrier method of contraception. Number 7. Patient Lina is currently receiving rifampicin as one component of her anti-TB regimen. At the same time, she is also taking oral contraceptive as her family planning method. As a healthcare worker, you should provide information that she has the option to do the following. Okay? Letter A, use progesterone-only injectables. Letter B, use of combined contraceptive patch. Letter C, use of an oral contraceptive with higher dose of estrogen. Or D, all of the above. Okay? So, yung mga unanimous yung mga nag-answer nyo. Their answer is letter D. So, let us check all of the above. Okay? So, sa lecture po, under contraception, no, birth control strongly recommended for all non-pregnant sexually active women receiving therapy for drug-resistant TB. No, this is because, and there is no contraindication to the use of oral contraceptives with non-rifamycin containing regimen. Advise a woman receiving oral contraceptives while on rifampicin treatment that she has the following options. Use an oral contraceptive pill containing higher dose of estrogen, or use another form of contraceptives which covers all of the above po sa ating options. Okay. Okay lang po yung pace ng ating answering or mabilis po? Okay. Okay na. Wait lang po, hanapin namin sino yung may maingay na pa. Okay, sige. Number 8. Anna Cleta, 28 years old, was diagnosed with MDR-TB and was initiated immediately with anti-TB medications. You have known, based on the information gathered, that she is taking oral contraceptive pill. During her teaching, we'll emphasize to take her oral contraceptive pills should be taken when? Okay, letter A, alongside with anti-TB meds. Letter B, 30 minutes after taking her anti-TB meds. Letter C, 1 hour prior to taking her anti-TB meds. D, at hours of sleep or bedtime. So, when is the best time to take the contraceptive pill when a patient is also taking anti-TB medication? Okay. Yun lang po. Okay. Yung mga nag-answer po is letter D. So, the correct answer is at bedtime po. Okay. Number 9. Patient Catherine Nang, a 48-year-old diabetic patient, is under your care for both management of TB and DM. So, diabetic o na ay TB ang patient. So, as your competent healthcare worker, you know that co-administration of BD2 and oral hypoglycemic agent will result to what? Letter A, QTC prolongation. Letter B, damage to kidneys. Letter C, blindness. Or letter D, sensory neural hearing loss. Okay, so, okay, mga answers. Unanimous ulit, letter A. Okay, letter A. May iba bang answer? neuropathy. Let's check. The correct answer is Q2 prolongation. So, to administer of BDQ and hypoglycemic agents such as sulfonylureas and glanise, since these agents function by inhibiting ATP-dependent potassium channels, thus delaying repolarization, which leads to QTC prolongation. So, to administer of BDQ and potentially hepatotoxic hypoglycemic agents such as thiazolidine. Basta yun po. So, it causes QTC prolongation po. Okay. Number 10. The presence of DM may increase the chances of adverse effects of anti-TB medication, specifically, letter A, renal insufficiency and liver damage. Letter B, renal dysfunction and peripheral neuropathy, blindness and renal calculi, or depression. Okay. Okay, ang answer nila sa chat are mostly letter B. Wala naman pong ibang nag-answer, no? Okay, let's check. Okay, so, ang answer is letter B, renal dysfunction and peripheral neuropathy. So, because nangyayari po ito, it may increase the chances of renal dysfunction and peripheral neuropathy, no? We use modern insulin or insulin analogs, especially in the early phase of TB, to achieve optimal blood glucose control with strict glycemic control. Wala po bang audio? Hello? Sound check. Okay, how's our audio po? Ay hinay. Wait lang, gihinay na mo ka, Jut, kay na ay helicopter dumaan. So, sorry po. So, ngayon po, okay na? Okay, so number 11. It is an anti-TB medication that may cause nephrotoxicity and must be used with caution in patients with diabetes. Unsay tambal ni siya that may cause nephrotoxicity? Is it letter A, sulfonylureas, letter B, linezolid, letter C, amikacin, or letter D, ethambutol? Alin ang merong bad effect sa ating kidneys? So, mostly answered letter C. Atong i-check. Okay, let's check. Correct answer is amikacin. Yun po yung possible effect ng adverse effect ng amikacin. Letter number 12. Treatment should be interrupted and modified, or an alternative regimen is used in the following. Okay? What are the conditions na mag-require sa ato to modify our regimen, no? So, number A, ALT elevation 3 times greater than the upper limit of normal in the presence of hepatitis or jaundice. Letter B, ALT elevation 5 times the upper limit of normal in the absence of symptoms. Letter C, none of the above. Letter D, all of the above. Which scenario should we modify ang atong or give alternative regimen? Okay, mostly answered letter B, all of the above. So let us check. The answer is all of the above. Kasi some of our medicines have effects on our liver. So kung dili within normal ang atong lab results, no, yung liver function, we really need to modify our regimen to avoid further harm to the liver. Okay, number 12. Number 13 na tanong. If liver function test cannot be done, it is advisable to wait for how many days after resolution of jaundice and upper abdominal tenderness before restarting TB treatment? So, is it 5 days, 14 days, 10 days, or 1 week? So, hindi man ta maka-perform ng liver function test, no? So, how many days ta mag-wait, mawala ang jaundice and abdominal tenderness before we reintroduce the TB medicines to the patient. So, may nag-answer. Oh, most of the answers are 2 weeks. So, let us check. Tama, 2 weeks po. This is just to be sure, no? So after 2 weeks, if liver function tests cannot be done, it is advisable to wait an extra 2 weeks after resolution of jaundice na abdominal tenderness before starting TB treatment. So, na ay okay, we would like to request katong wala naka-off sa microphone to please check your mic. Okay. Okay. Number 14. Jeremy is a diagnosed case of chronic liver disease. He was recently diagnosed with PTB. He was never treated with TB in the past. So, wala siya history of TB treatment. So si Jeremy should not be given pyrazinamide. As such, which among the following alternative regimen may be given to him? So, although wala daw siya naka-receive of TB treatment before, pero dili daw siya pwede hatagan og pyra. So, unsa ang alternative regimen para sa iya? Okay, ang answer? Unsay answer of the group? Okay. The answer is all of the above kasi the patient has chronic liver disease. We all know that pyrazinamide is the most hepatotoxic. So, kung maghatag-patag pyrazinamide, mas further natin ang damage sa kanyang liver. So, we do not give pyrazinamide for patients with liver problems. So, we can give the patient yung mga choice letter A, B, and C. So, it will work for the patient. No? Okay. Number 15. The use of bedaquiline and delamanid is not contraindicated with patients with, so pwede lang bigyan. So, is it mild to moderate renal insufficiency, mild to moderate hepatitis, none of the above, or all of the above? So, unsay answer sa group? So murag unanimous ulit, letter D ang gi-answer. So, let us check. Okay, the answer is both A and B. So, pwede ibigay ang delamanid and bedaquiline for patients with mild to moderate renal insufficiency and mild to moderate hepatitis. Basta always use with caution po. So, we do regular monitorings and close watch sa patients na mayroong ganitong condition. Okay. Number 16, Afnata. Okay, all of the following first-line drugs would require dose adjustment in case of renal insufficiency with creatinine clearance below 30 ml per minute, except, is it isoniazid, pyrazinamide, ethambutol, or none of the above? Okay. Oh, answer. Good morning. Ang nag-answer po, mostly answer letter A. So, let us check. The answer is isoniazid. Okay. Number 17. BFD, 23 years old male, was diagnosed with HIV recently. He was referred to your facility and was diagnosed with pulmonary tuberculosis by expert MTB test. He claims to have been treated with TB the year before his consultation. So the patient is a retreatment case. The approach to treatment would be, letter A, start anti-TB treatment and await 8 weeks prior to antiretroviral therapy. Letter B, if CD4 count is less than 50 cells per cubic ml, ART should be started within 2 weeks. Letter C, the patient should receive cotrimoxetol prophylaxis for other infection. Or letter D, all of the above. So if a patient has HIV and has TB also, Ano po yung approach to treatment? Okay. Okay. I can see answers letter D. Letter D, all of the above. Okay, let's check. The answer is letter B, all of the above. So, in patients with HIV-related TB, no, the priority is to treat TB, especially bacteriological and confirmed PTB, to stop transmission. And we also know that the immune system of HIV patients are weaker than those who do not have HIV. No? So we would like to be able to treat the TB as early as possible. Patients with HIV-related TB can have antiretroviral therapy and anti-TB treatment at the same time. Basta manage carefully po. And then careful evaluation is necessary in judging when to start anti-ART. Okay. Number 18. You have started BFD, an HIV patient, on DRTB regimen containing BDQ. What antiretroviral drugs should be avoided once BFD is started on antiretroviral therapy? Is it efavirenz, nevirapine, dolutegravir, or none of the above? Okay. Okay. Medyo parang toxic ang question nyo kay MDR na, especially for the RHs who are not managing MDR cases, no? Okay, so ang answer, sige nga, answer ni ccmctb.pmdt is letter A. Most of you also answered letter A, so let us check. Okay, the correct answer is letter A. Okay. We should replace EFB with NVP if the virus is still susceptible and patient has no toxicity to NVP, because EFB decreases BDQ blood concentration level by 52%. So we allow 5 days washout of EFB to be replaced with NVP. So, however, if patient is critically ill, start MDR treatment immediately. No need to wait for washout period. So, i-weigh po kung ang level of pagiging severe ng patient or not for appropriate action. Okay, number 19. Patient with seizure disorder should be given the following anti-TB medications unless they are crucial component of the treatment regimen. Okay, letter A, cycloserine and profenamide. Letter B, high-dose isoniazid and rifampicin. Letter C, cycloserine and high-dose isoniazid. And letter D, linezolid and isoniazid. So kung ay seizure disorder ang patient, ano po ang hindi dapat ibigay na anti-TB medicines unless kailangan na kailangan talaga siya. Okay, so the answer, most of you answered letter C. Okay, let's check. The answer is letter D, cycloserine high-dose isoniazid, because these two drugs can cause seizure. So kung nanay seizure disorder ang patient, mas i-trigger pa niya na mag-seizure ang patient kung ibibigay pa po natin to siya. So we should avoid cycloserine and high-dose isoniazid in patients with active seizure disorders that are not well controlled with medication. So, in case where cycloserine or high-dose isoniazid is crucial component of the treatment regimen, it can be given and the seizure medication adjusted as needed. So, kung kailangan na kailangan siyang ibigay, so ibibigay siya, and then the seizure medication should be adjusted accordingly po. Number 20, prophylactic use of oral pyridoxine may be given in the following doses. Letter A, 10 to 25 milligrams per day for at-risk patients on isoniazid. Letter B, 10 to 50 milligrams per day for pediatric patients at risk of neurological sequela. Letter C, 25 to 50 milligrams for every 250 milligrams of cycloserine, or letter D, all of the above. Murag safe answer man no, all of the above. Okay, atong i-mute katong wala na ay na-open na microphone. Okay, yes. So unsa yung answers group? Si Ma'am Luzvi Miniaporan. Okay, we will mute you, ma'am, kasi okay, yun. Okay, unsay answer sa group? Okay, letter D mostly answered, letter D. So answer is all of the above, no? So D po ang answer. All of the above. Number 21. As part of the initial evaluation, all female cases of childbearing age should be assessed for pregnancy, which includes the following. So, di ba kanina yung question number 1 natin about pregnancy yun, no? So, itong question number 21, about pregnancy din. So, what should you assess in females of childbearing age? So, is it letter A, getting information on the last menstrual period? Letter B, doing a pregnancy test. Letter C, both A and B. Or letter D, none of the above. Walay audio daw. Sige po, i-check namin Ma'am Franz no, ang audio. Okay, hello? Sound check? Ana-ara? Okay, sige, padayon ta. So, unsay answer? Unsay answer sa group? Pag childbearing age ang patient, unsay SOP dapat nga assessment sa patient? Okay. Parang same lang siya ang thought same sa question 1, no? Na iba lang ang phrasing ng question. So, ang answer is both A and B. We should always check kung pregnant ang female patient or not before proceeding to any management po. Okay, number 22. DRTB treatment in pregnant women may be select all that applies. If ever dili siya makaklik ng daghan choices, okay ra to, don't worry, basta ma-check ninyo ang isa. Correct na siya, gina-correct na siya ni Google. But for the benefit, for the purpose of our discussion, unsa ang possible answers for this question? Okay? Naay nag-answer letter A, naay nag-answer B. Napod nag-answer letter C. Okay, check na to. The answer is both A and B. So we should delay until the second trimester if clinically stable with minimal radiologic findings, and B, initiate treatment immediately if clinically unstable. No? Kinahanglan gyapon i-weigh ang pros and cons of treatment, especially pag burus ang patient, no? If a TB patient becomes pregnant during the treatment naman, follow up the newborn for 12 months postnatal to check for congenital abnormalities. If during the treatment po, yun. Okay, number 23. The following may be considered consequences of not treating a pregnant patient with TB except. So, kung say possible consequences no kung dili i-treat ang pregnant patient with TB. Letter A, hyperemesis gravidarum. Letter B, preeclampsia. Letter C, vaginal hemorrhage. Or D, fetal loss. Kung say possible mahitabo sa buros if nanangay TB if dili siya ma-treat for TB. Okay, letter A. A. Sige, mostly hindi. Okay, unsay answer sa group? Oh, sige, mostly answer is letter A. Okay, hyperemesis gravidarum. So for in pregnancy, no, the possible consequences of not treating a TB pregnant patient is hyperemesis gravidarum. So yun po. Except no except po pala. Except pwede siyang if you will not treat a pregnant woman who is a TB patient with anti-TB medication, pwede kasi siyang magka complications such as preeclampsia, vaginal hemorrhage, or fetal loss. So sa question po is except. So hindi naman magkaka-hyperemesis gravidarum ang patient if you will not treat. Okay. Number 24. DRTB patients have high rates of depression. Actually, yes. Isa ito sa side effects ng one of the drugs, no? So, and anxiety due to chronicity of the disease and socioeconomic stressor. As such, which among the second-line drugs should be avoided? So, syempre, DRTB patients, no, most of them might be depressed kung bakit sila DRTB, no? And then they might experience anxiety of having the disease as well as the economic impact ng kanilang sakit sa kanila. So, because we know that there are drug-resistant TB drugs who might cause, meron siyang psychological effect din sa patient, no? So, ano po yung i-avoid natin if a patient already has depression and anxiety? So, sagot po ng group is mostly letter D. So, okay, let's check. The answer is cycloserine, no? We should give special caution should be considered in using cycloserine, but it is not absolutely contraindicated. Ano lang siya, least priority in giving this medicine for patients who have merong inclination of being depressed and anxious. Patients with psychiatric disorder should undergo psychiatric evaluation prior to start of treatment. Okay, so, number 25. Patient Lovey, 23 years old, has been battling seizures since she was a child. She has been experiencing recurrent seizures despite intake of medications. She was recently diagnosed with MDR-TB. In designing her regimen, which among the following anti-TB drugs are to be avoided? So, meron daw siyang seizure. So, active seizure siya, no? Recurrent seizure. I believe this type of question was already asked earlier. Iba lang po yung phrasing. So, ano po yung anti-TB drugs for MDR-TB that should be avoided? Is it cycloserine, isoniazid, or both A and B, or letter A only? Okay. Mostly answer letter C. Tapos si ating GCMC TB dots PMDT. Ang answer niya po is since seizures are uncontrolled, answer is letter C. Okay. Yes, both letter A and B. Cycloserine and isoniazid may cause seizures po. Okay, very good. So far, wala. May naka-perfect sa exercise na ito? May naka-perfect score? 30? Okay. Number 26. Diagnosed TB patients with substance dependence should be. So, letter A, referred for therapy in specialized institutions. Letter B, should not be started treatment. Letter C, evaluated and assessed during the CAGE questionnaire. Or letter D, both A and B. Okay, so itong mga patients na ito may substance dependence. So, ano ang dapat? Okay, answer. May nag-answer ng C, may nag-answer ng D. May nag-answer din ng A. Okay, let us check. Okay, the answer is both B and C. Patients with substance dependence disorder should be referred for therapy in specialized institutions. Special caution should be considered in patients taking cycloserine. So, kasi we all know, yung mga tinatake na, yung any substance dependence might affect also the efficiency of our anti-TB meds. So, before starting the treatment, kailangan ma-refer muna sila and hopefully they are sober no before you start the treatment for TB. Okay, number 27. Renal failure in TB case may be due to the following, except letter A, concomitant renal problem, letter B, UTI, letter C, result of previous DRTB treatment with SLI, or D, disseminated TB with renal involvement. Renal failure may be due to except. Okay, okay, unanimous ulit lahat. Ang answer sa group chat is letter B. So, let us check. Okay. So, ang UTI po, hindi nakakakos ng renal failure for TB patients taking anti-TBs. Okay. Number 28. So, we're down to our last 3 questions. Okay. To safely prevent transmission of TB from mother to her breastfeeding infant, letter A, contact between mother and child should be limited with the mother when the mother is TB culture positive. Letter B, contact should occur in an open space, possible. Letter C, mother should wear a surgical mask or respirator. Letter D, all of the above. Murag same kind of question, no? Yung thought of the question was already asked kanina. So, how do we prevent transmission of TB sa breastfeeding, lactating mother? So, unsa ang dapat himuon? Letter A, letter B, letter C, or all of the above? Okay, mostly answered, all of you answered letter A. Letter D, sorry, all of the above. Yes. So, as much as possible, ayaw din naman natin i-prohibit ang child from receiving the breast milk from the mother. So, kung kailangan talaga siya i-breastfeed, no, dapat gawin siya in an open space if possible. Dapat the mother should wear a surgical mask or respirator. And if positive po ang kanyang culture result, delay lang po muna natin until maging negative po yung culture niya. So that's safe naman po ang baby. Okay, number 29, second to the last question. Which of the following second-line anti-TB drugs should be avoided in the presence of seizure disorder in TB patients? Okay. Seizure again, seizure disorder. So, unsay kinahanglan i-avoid. So, as you can see, no, gina-repeat nila yung question, yung topic, no, let's say seizure, pregnancy. Siguro for our retention po ito. Okay, so unsay kinahanglan i-avoid? So, okay, letter A, lahat nag-answer is letter A. Let us check. Okay, answer is cycloserine. Kasi yung cycloserine and high-dose isoniazid can cause seizure sa ating patients. So, for those with seizure disorders, we should avoid these or else tayo ang mag-trigger ng seizure ng patients.
Clarification for the speed for the element when discontinue positive
Okay, number 30, last but not the least question. All patients receiving the following anti-TB drug should be given pyridoxine prophylaxis except, is it linezolid, cycloserine, delamanid, or isoniazid? Okay? Kung saan dili dapat ibigay. Okay, mostly answered letter C. Let's just check. Okay, the answer is delamanid. Okay, congratulations for completing exercise 11. So supposedly, we still have 2 exercises for this week's module, no? But since there was a delay in uploading the video lecture ng DRTV, no? And then we understand, hindi siya ganun ka light na topic, no? Kailangan talaga siyang pagtuunan ng pansin. So, ng pagtuunan ng time. So, the team decided to delay in giving the exercise for DRTB treatment. So, since tapos na po tayo sa exercise 11, we will be emailing the link for exercises ng DRTB this afternoon po. Kasi na-send na po namin yung link of the lecture few days ago. So, we will be sending the exercises this afternoon. Yung yung discussion of the answers po would be next Friday po, together with next week's exercises din po. So, bibigay na namin early yung exercise ng DRTV para hindi po siya magtambak together with next week's lecture. So, may free time po kayo when you will answer it po. Okay, so just a few, before I proceed sa reminders, any questions for clarification from the group that you would like us to discuss or any suggestion po? Okay, none po. O, sige po. I will continue. Reminders. So, na-complete na tag 1 to 3 weeks of our self-paced blended online training na ating MOP module. No? So, next week, we will be on our 4th week. It will be the second to the last week. So, dating gawin po, on every Monday, we will send the link and the module po. We will send the link of the video lecture. We will also be sending the PowerPoint presentation for those na lisod maka-access sa internet, so at least they could read the PowerPoint po. So, by Thursday or afternoon of Wednesday, we will be sending the exercise link. We have 2 exercises for next week po. And then, by Friday po, we will be discussing the answers to the question. So, we will have 4 exercises to be discussed next Friday. Okay, the topic for next week, it would be Module 8, Management of SAE, and then Module 9, Active Drug Safety Monitoring, ADSA. Okay. So, yung, usually, diba yung discussion natin of exercises is morning session and afternoon session. But we will inform you if we would be discussing it every morning na lang po. We will just update you po sa group chat. So, thank you everyone for giving us 1 hour of your time today for participating. So, those na wala naka-join sa atua, we will be sending the link of this recorded session. No? Hopefully, dili magka-aberya sa sa pag-save sa atong recorded session ngayon. No? And then, may question pa si Doc Roel. Are we provided hard copy of the manual of procedure? So far, Doc, we are working on the budget for the reproduction. So, while wala pa po yun, we will be providing you the soft copy of the module at the end of the training po. Pero, abang na lang po tayo, Doc. Soon, hopefully, maka-reproduce na kami. Nag-aantay lang po kami ng budget from central office to do the reproduction. Okay. Yes, don't worry po. We will give you a copy of the MOP po. So, any other questions po and concerns before we end today's session? Okay. Wala na po. So, in behalf of the DOH Regional Office and PPT, would like to thank you once again for joining us. Bye-bye po and have a great weekend ahead of you po.